Well, good evening, everyone. Thank you for joining us this evening. I'm David Dodick. I'm the chair of the American Brain Foundation's Board of Directors, and I'm delighted to be here tonight with a world-renowned neurologist who you're going to hear from shortly. Normally, these salons were made available to our donors to show our appreciation for their generosity. But, we felt the content is just so timely, so cutting edge, and delivered by world-renowned experts in their respective disease that we decided to open these to the public as well. And so we hope that you all enjoy. And I want to thank those of you who have donated to the American Brain Foundation for your generosity. We greatly appreciate it. And you know all too well how wisely that money is spent, and the number of researchers, and both young and established, and the great science that we're able to fund to move the science of brain disease forward. So tonight, we're joined by another world-renowned neurologist, Dr. Lisa Shulman. Dr. Shulman is a neurologist specializing in Parkinson's disease, movement, and memory disorders. She is Eugenia Brin Professor of Movement Disorders, a Rosalind Newman Distinguished Scholar in Parkinson's disease, and she is the director of the University of Maryland's Movement Disorder Center. She has served as the treasurer of the American Academy of Neurology, and I was fortunate, she was also on the board of directors of the American Academy of Neurology. And for my first few years on the board of the American Brain Foundation, I was fortunate to learn from and get to work alongside Dr. Shulman. She's also been on the board of the Promise Health Organization. And in 2018, she received the coveted President's Award from the American Academy of Neurology for her contributions to the Academy, our partner, and the neurology profession in general. Dr. Shulman's major research interest is in the impact of chronic conditions and chronic diseases, such as Parkinson's disease, on the function and quality of life of individuals who suffer. Her related interests include the brain effects of emotional trauma, cognitive behavioral disorders, health disparities, exercise, biosensors, outcome measurement, and data visualization. So a very broad range and spectrum of interests. She has served as the principal investigator on numerous studies, including developing measures of self-efficacy for managing chronic conditions and studying the effects of cognitive impairment on the validity of questionnaires. Dr. Shulman is the author or editor on over 200 books, chapters, and publications. Impressive indeed. She is the editor-in-chief of 14 Brain and Life patient books, and she is the co-author of Parkinson's Disease, A Complete Guide for Patients and Families, and also author of Before and After Loss, a neurologist's perspective on loss, grief, and our brain, which will be the focus of her comments and the discussion tonight. Dr. Shulman, it's an honor to have you. Thank you for joining us. The floor is yours.
Well, thank you indeed, David. It's a special pleasure for me to be here with the American Brain Foundation, since I served on the board with you and with Jane Ransom for many, many years. So I look forward to telling the audience tonight about healing your brain after loss, a neurologist's perspective. So, a number of decades ago, psychiatry and neurology were really considered as very, very different fields. But in recent decades, it's understood that actually psychiatry and neurology are the same thing. What do I mean by that? Well, the fact is that all of our experience, all of the feelings and emotions that we have, our very rich emotional life, intimate relations, all of those are markers of brain function. So when we talk about loss, it's very important to sort of start out by understanding that I'm talking about loss and the way in which it comes in many forms. And one of the ways to think about that is about stressful life events. A very famous study of stressful life events was done by Holmes and Rahi. And this was a long time ago in 1967. I want to tell you about it. It was quite interesting. Uh, the investigators asked the study participants, lots and lots of people, to do the following thing. Their instructions were that they had a list of life events and they asked the participants to rate them in terms of how you view the amount of adjustment you would need in order to deal with that event. Use a scale with a low of 1 and a high of 100. And what you can see on the right-hand side of the slide is the very top 16 of many, many items on the scale. And these are rank ordered. So quickly going through a few of them, the first couple of items involve death of either a close loved one, particularly a spouse, but any close family member, or major injury or illness to either yourself or a close family member. Those scored between about 70 and 90. Other things that are really scored high on this scale of stressful life events were divorce, being the victim of police brutality, something in the news recently, experiencing domestic violence or sexual abuse, being fired or unemployed, surviving a disaster. So one of the important ways that we need to think about these different types of events for the purpose of this talk is that these stress-related disorders are really a spectrum of emotional trauma. We're accustomed to thinking about them as very individual experiences, but we're going to talk about how, from the brain's perspective, this is instead all seen as different degrees and levels of emotional trauma. In other words, a spectrum of post-traumatic stress disorder, PTSD, which we oftentimes think is only combat related, but now is understood as any of these emotionally traumatic events. So here's a key, there's lots of key different messages that I want to get across tonight. And one of them is that this graphic sort of pokes fun at the idea that different serious stressful events would exist in different regions of the brain, and it's far from that. In fact, the brain only has one way, one set of processes to respond to traumatic loss. In other words, our brain is agnostic to the type of emotional trauma, and we'll be talking about those brain processes. So another key message is that from the brain's perspective, traumatic loss is perceived as a threat to survival, which is a bit of a paradigm shift because we usually think about that as when there's a physical threat. But again, we'll see as we go along that from the brain's perspective, it's everything's being judged in terms of the degree of threat to our survival. The brain defaults to a whole bunch of protective survival and defense mechanisms. And we're going to talk right now about the effects of both acute stress and chronic stress and about brain mechanisms. So in the left-hand side of the panel, that is showing the very, very well-known fight or flight mechanism, where very simply, up at the top here, you can see a structure in the brain, which is part of the primitive brain. It's called the limbic system. And this red structure, if you can see within the brain, is a part of the limbic system known as the amygdala, which is kind of the fear center. It's surveilling the environment, and we'll be talking a lot more about that. When the amygdala of the limbic system picks up a signal that there's a threat, it triggers this fight or flight mechanism, which is a whole cascade of hormones and inflammatory mediators, which we aren't going to go through. But the point is that once all of these, this cascade of events goes into place, your blood pressure rises, your heart rate increases, and your body is mobilized to fight or flee from a predator. You can see on the right here, in another example of this, we start at baseline, at homeostasis, and then there's a perceived threat. And then this fight or flight mechanism kicks in. Well, in many cases, like if you're on a hike and you see a proverbial bear, and then the fight or flight mechanism kicks in, the bear hopefully hightails it out of there, and you go right back down to baseline homeostasis, and the threat is over. But when it comes to all the different types of stressors that we looked at on that Holmes and Rahi scale, in every case, that is not going to be the kind of thing that resolves quickly. Indeed, many of those events are permanent and lead to chronic stress, which is actually a state of experiencing fight or flight on a daily basis due to various reminders and triggers. The pervasive effects of chronic stress occur not only on the mind and brain, but also the body, with a whole range of symptoms, including changes in memory and our behavior and sleep, and many, many changes, in fact, to body function, including immune system and heart function. You could see at the top here a photo of showing ballooning of the ventricle of the heart. And actually, in response to chronic stress or acute stress in particular, the contractility of the heart is altered in such a way that the ventricle balloons out into this abnormal shape. The name of this syndrome is actually, the common name is broken heart syndrome, but the medical name is Takotsubo syndrome. And that was named for a Japanese octopus trap, which is called a Takotsubo pot because of the similarity in the shape. So a key part of understanding what's going on in the brain is to understand the concept of neuroplasticity. And neuroplasticity is simply defined as the remodeling of neural connections based on experience. So after loss, our brain actually rewires itself because stress is a very potent activator of neuroplasticity. In the pictures here, it's showing a progression of two different nerve cells and the interconnections between two nerve cells. The fact is that there's a dose response curve between stress and the effects on the brain, where low to moderate stress is actually good for us and results in good neuroplasticity with very enriched connections between brain cells, which you can see on the right there. And when you have these better connections, you generally have increased memory and less fear. On the other hand, chronic high stress, which we were talking about before, results in weakening of connections between nerve cells due to bad neuroplasticity, resulting in memory impairment and increased fear. So the key thing to remember from this slide is that neuroplasticity moves in both directions, both in response to traumatic loss in this bad direction, but also in response to healing and restorative experiences that we'll be talking about. The sequelae of these weakened brain cell connections and all sorts of psychological defense mechanisms that kick in when we're going through traumatic loss and difficult times, things like denial and dissociation, results in disruption of lots of different cognitive domains, different parts, different components of cognition, including memory, executive function, attention, and the speed of information processing. Over the years since the book's been published, I've given a lot of these talks, and at every single talk, lots of people who are going through periods of loss talk about the sense of mental fog that they experience. A cool phrase that neurologists use is that neurons that fire together wire together. And what they mean by that is simply that when a circuit fires repeatedly, it's reinforced and becomes a default setting. So this is another way actually to describe the concept of neuroplasticity. The more a circuit fires, if it's a good circuit, that's great because you're going to reinforce and you're going to learn something. But it works for bad purposes too. If the circuit is one that is promoting a lot of fear and anxiety, then that can be reinforced. So I mentioned before that a key part of the primitive brain is the limbic system, and a key region in the limbic system is the amygdala, which you can see as that yellow oval in the middle of the brain diagram there. So the amygdala, as I said, regulates our perception of vulnerability and threat. And in a normal state, there is a really good balance between the amygdala and its need to surveil the environment for threats and the judgment of our cerebral cortex. So the cerebral cortex is this big mantle around the brain with all the gyri and wrinkles that we're used to thinking about when we see the brain. And this is the seat of our advanced brain, where there is reasoning, logic, coherent thought, and judgment. So in a normal state, there should be a good balance between the primitive brain and the advanced brain. But in an unhealthy state, a loss of balance results in a fear system on overdrive. And that is the bad spot that many people find themselves in after serious traumatic loss. We can actually see here a few pictures of nerve cells from animal models in the control state on the left and under a chronic stress state on the right. And basically what you see is that when you're talking about the cerebral cortex, that seat of logic and coherent thought, unfortunately in the stress state, the neurons are being atrophied, are shrinking down. The opposite occurs in the amygdala, the fear center, where the neurons are enriched. All this is due to neuroplasticity again, and results, unfortunately, in the imbalance we're talking about. So we can see here this imbalance where the amygdala becomes very strengthened. And a leader in this field, Dr. Van der Kolk in Boston, called the amygdala the smoke detector and the cerebral cortex the watchtower. So this imbalance causes the smoke detector to be strengthened, resulting in increased anxiety and hypervigilance. And the watchtower that should be exerting more of a healthy balance and resistance is being diminished in its strength. So the bottom line is that there's a disconnection between the cognitive and emotional components of traumatic memory. So this photo is meant to make the point about how the primitive brain that we were talking about and the response of the amygdala and fight or flight and everything we just talked about is highly evolutionarily conserved. We have those reflexes, and animals, many animals do also have this reflex. So, and one of the most interesting things is that the amygdala, that part of the limbic system, responds before the conscious mind is even conscious of the threat. It is so fast to respond that you're actually trying to hightail it away before you're even aware of the danger. So we don't have any voluntary control over the amygdala and its responses. So one of the things we're really trying to do in this kind of discussion is to normalize the concept of grief and traumatic loss, to understand that loss is perceived as a threat to survival, and that grief is really a normal protective process, not something weird or stigmatized. As I said, this whole process is an evolutionary adaptation to promote our survival in the face of emotional trauma. The same doctor I mentioned before, Dr. Van der Kolk, said the most important job of the brain is to ensure our survival even under the most miserable conditions. Everything else is secondary. This is another one of my favorite quotes from the literature, from a very good medical paper called The Bull and the Evolutionary China Shop. The author said, the misery caused by a hyperfunctional amygdala in PTSD is the cost of inheriting an evolutionary primitive mechanism that considers survival more important than quality of life. Okay, so we're going to turn in the final moments to talk about how can we reconnect the emotional and cognitive components of memory to foster healing and restoration. Well, we're going to be focusing on the healing properties of mindful contemplative practices, but we have very little time. So I'll kick this off by using a quote from Joan Didion from The Year of Magical Thinking. "Was it only by dreaming or writing that I could find out what I thought?" Joan Didion said. And we'll talk a little bit now about writing and dreaming as mindful practices that are very important and therapeutic. So there's a lot of science behind journaling, writing about one's experience after traumatic loss. And the question really is whether, some people have asked, is it preferable to express emotional thoughts or suppress them when you're going through very difficult times? And the science very much supports that it's better to express rather than try to just simply distract yourself. There's lots of unique benefits of journaling, including, it's a very unique kind of a thing because it gives you an opportunity to reflect in the moment when you're writing down on a piece of paper or at a computer what is troubling you. And then later you can go back the next day, the next month, the next year, and reappraise your own writing in order to annotate it further as it spurs new memories, or to actually observe your own progress over time. Another unique quality of journaling is that you have an opportunity to write for yourself and no one else. The fact is that whenever we, as much as our family and friends, or perhaps a counselor wants to help us, in all those situations, we involuntarily are going to censor or filter our thoughts. Journaling, one can be more raw and truthful and honest to oneself, which isn't so easy, really. So how about dreams? Dreams are actually a potent tool for reconnecting with painful memories that have been suppressed in the subconscious. We can't actually connect with that cognitive content anymore. Freud said the interpretation of dreams is the royal road to a knowledge of the unconscious activities of the mind. And when you're going through the difficulties of emotional trauma, reconnecting at some point to those unconscious activities is a key to healing. So just a word or two about dreams. Here we see that Dr. Hobson, an emeritus professor of psychiatry at Harvard, asked, why is it that we need to create an artificial world offline and spend 2 hours a day in it for dreams? Well, dreams during REM sleep, rapid eye movement sleep, are a vital process for memory, consolidation, and healing. It's usually a kind of analogized. The analogy is that you're consolidating experiences while you're dreaming into a vast filing system in the brain. But the problem is that difficult memories, highly traumatic memories, can be too disturbing to be integrated with any past memories, and they can't be filed away. And instead they sit there and cause a whole lot of difficulty for us. So keeping a dream journal is one very important way to start to reconnect with those unconscious memories. So in summary, and in this final slide, neuroplasticity is very important because it helps us understand that we have some conscious control over this, because the brain rewires itself in response to experience. And we can therefore steer in the direction of the kinds of experiences, the mindful contemplative practices that can begin to lead us in a direction of good neuroplasticity, as I mentioned before. The goal, of course, again, is to reconnect the emotional and cognitive components of memory again, and to restore the healthy balance between the advanced brain and the primitive emotional brain.
No.
So with that, I'm done, and I really am very interested in your comments and questions.
Dr. Shulman, thank you so much for that wonderful, important, and relevant talk, particularly at this time. So I would like to open it up for questions, and you can feel free to ask your questions live or type them in the chat box. I will read them for you.
What?
And maybe I'll ask everyone, if you're not asking a question, please mute yourself, mute your line. So maybe, Lisa, maybe I'll start with a question myself. You talked about adaptive and maladaptive neuroplasticity, such that the brain can wire itself in a maladaptive way in response to chronic stress. Is that reversible?
Yes, it definitely is reversible. The bad neuroplasticity or maladaptive neuroplasticity and wiring that you're talking about, it starts out, David, as the brain's effort to protect itself. It starts out as doing something in order to gear up for daily fight or flight under siege. And it turns into something that is so maladaptive. And the more it happens day after day, the more it's getting hardwired and less in control. So, what I have found in speaking to many people going through difficult times like this is that it's therapeutic in and of itself to understand the brain processes behind this. Because many people, when they're going through emotional trauma, feel very isolated and feel that their experience is frightening, maybe even like as if they're going crazy because it's so different than what they had previously experienced. But the fact is understanding that, number one, there's an explanation for all this. Number two, our brains are all hardwired the same way. So when we go through hard times, we experience very similar things. And number three, you can reverse it in many ways using various means. It goes on and on. The list would be endless to talk about the individualized ways that people can use creativity and mindful practices, as well as more traditional things like counseling and so forth.
That's a good segue to this question. Do you feel it's appropriate for process trauma, even if they don't have the coping skills to be able to handle it?
Can you repeat that because you phased out?
I feel it's appropriate for everyone to begin to process trauma and deal with it, even if they don't have the coping skills to be able to handle it.
Yeah, that's a very good question. I think that, I'll just say in general that if we are not going to work through the traumatic experiences that we have, they will continue to be an obstacle for us in our lives. It's not, in general, when one experiences emotional trauma, it isn't something that is going to end in any finite period of time. And virtually in all cases, for the rest of one's life, you're going to be coping with the fact that you experienced something that was so difficult in your life. If you do not deal with it on some level in order to make it part of your life story, if you will, something that you can understand and that you can talk about without getting very, very anxious, then it'll be an obstacle to your growth, to going on and fulfilling your potential, one might say, in your life. Many people today talk about the concept of post-traumatic growth. And what they mean by post-traumatic growth is the very idea that one does accept and learn to understand and learn to be able to remake their life with these traumatic events as part of their life. And it leads to a greater understanding and a new level of wisdom in their life. That can only occur by confronting these things.
I guess to also continue a little bit with my question is, so for example, I guess I'm referencing, I work with like children who experience like emotional trauma in foster care. And I feel that a lot of them repress, right? They repress these memories as a protective factor. So I guess my follow-up question would be, do you think it's really appropriate for kids, especially kids given like who might not be in the greatest environment yet? Because I'm of the mindset in my experience that if they don't have a very well put together household and those sort of things, that it might not be the easiest thing for them.
I mean, I think, first of all, my comments are mainly directed towards adults because I am an adult neurologist. And I think that children, there are some very, very different sorts of situations when it comes to children. But I'll just say in a more general way, whether you're talking about adults or children, we're not talking about the need to do this in any particular time frame. But that instead that it should be a long-term goal. And that obviously that would be different for people who have different levels of resilience and coping skills.
Thank you. That's really helpful.
You're welcome.
Lisa, in terms of treating and confronting trauma, whether it's counseling or mindfulness or cognitive behavioral therapy, are there pharmacological treatments that can help either deal with and cope with trauma, or indeed work through the trauma with pharmacological assistance? So I guess, are there any drug treatments is what I'm asking.
Right. I mean, it's an important question because for one thing, it's always important to start by clarifying that grief and depression are two very different things. And in numerous studies have shown that the use of the most common drugs that are used are antidepressants, but that will oftentimes ameliorate or relieve depression, the depressive symptoms that can be associated with grief, but not the actual symptoms of grief or the symptoms of trauma, post-traumatic stress disorder, for example. So that there's been a lot of difficulty in finding approaches that had a significant effect on post-traumatic stress disorder symptoms. Whether you're talking about CBT, or if you're talking about cognitive behavioral therapy, or if you're talking about FDA-approved drugs for PTSD, that includes, I think it's paroxetine and one more, maybe sertraline, I can't recall right now, that are FDA-approved drugs for PTSD. Actually, the effects are very modest. But recently, you may have seen some stuff in the newspaper showing that, and this is kind of incredible, but the psychedelics are being studied for post-traumatic stress disorder. And in particular, and these include like MDMA and psilocybin and others. Of course, people know LSD, ketamine, there's a group. But MDMA is right now on a certain list that the FDA has as showing quite a lot of promise as a breakthrough drug for PTSD. The phase 2 trials were highly effective, much more effective than the antidepressants. And now phase 3 trials are going on where it's actually expected that this is going to be approved for PTSD in 2 years, in 2023. So it's interesting, the way in which this is done is it's MDMA assisted therapy. So it's done with a therapist, and it's believed that the psychedelics may have the capacity to actually work on neuroplasticity itself, to promote, with a therapist's help, this type of therapeutic good neuroplasticity. So it works right in with what we're talking about.
Really interesting. There's a question here. Have there been any studies on meditation and grief processing?
Yes, there's been a good deal of work on meditation, and I've reviewed some of that literature. There's interesting literature showing that people who engage in meditation, you can actually show in terms of functional neuroimaging known as functional MRI. You can actually show changes in the brain based on these kinds of practices. And there has been some benefit shown. So yes, that is very true. I think, part of it is that when we're going through very difficult times, it is very hard to get to find a safe zone, a place where one feels safe and can relax enough to allow these healthy neural circuits to develop. And so, meditation is one of those things that may allow a feeling of safety and security and calmness so that one can move forward.
Thank you, Lisa. Interesting. There's a question here. I lost my husband to Parkinson's with dementia last year. I'm getting very little REM sleep. Can you recommend ways to improve that for my own healing?
Well, I'm not sure how you know that you're not getting a lot of REM sleep. One would usually know that they're not getting sleep. I think in general, there are many different things that can be done to promote better sleep at night, ranging from mild over-the-counter remedies like melatonin to more, drugs that require prescriptions. And I think that would really be the kind of thing that you'd want to see a clinician about, because you don't want to in any way take something that isn't right for you based on your entire medical profile. So I would really recommend that you see a health professional about that.
Another question, Lisa, is if there's more than one traumatic memory, do they all sit there?
Well, there has been work done on people who have repetitive emotional trauma, and it is, number one, shown that there is a cumulative effect, and that sometimes a new emotional trauma causes the unresolved emotions from a previous trauma to come to the fore once again. So there definitely is, a cumulative and difficult effect of having more than one trauma.
Yeah. There's a question here asking, when are you healed from loss? When is your behavior or feelings no longer under the umbrella and excuse of grief?
I think that there's, in the past, there was a tendency to think of grief as something that the people who would go through grief, that they would go through certain stages, and that at some point it would be a matter of closure, and then you would go on. It would have healed over, like time heals all wounds. And among the leaders in the field of emotional trauma and loss and grief, that's gone by the wayside. It's now understood that we all are individuals. Our traumatic losses are highly personalized and highly individualized, and that everyone's going to go through their own path or journey, and in their own good time. And it shouldn't be forced, and one shouldn't feel that there's any arbitrary timeline or that you're doing it the wrong way. Instead, it's a matter of making progress over time, that one is doing somewhat better. But when it comes, for example, to the example of when you lose somebody close to you that you love, it's turning towards feelings of honoring their memory in ways that are very comforting to you over time. Whereas in the beginning, the overwhelming sensations are, unfortunately, pain and yearning, and that at some point it starts to move into a direction of finding ways to honor somebody. Now, that doesn't mean that the feelings and pangs of loss ever resolve. They don't. And they, and everybody talks about waves where they come and go. However, there is a progression, there should be a progression in healthy function towards a more post-traumatic growth.
Mhm. There's another question here. Do most doctors and therapists agree that grief and loss are forms of PTSD, or is there an educational process that needs to happen?
Well, I think that the more one thinks about it, that the designation of PTSD, which was solely used for combat-related trauma, if you read a lot about the symptoms of PTSD and the symptoms of any type of emotional traumatic loss, all those stressors that we started out by talking about, the symptoms are very overlapping. If you're talking about, feelings of anxiety, loss of sleep, flashbacks of events, well, people who have experienced all types of traumas have those symptoms. So over time, it has been a progression towards expanding the definition of PTSD to encompass all of this. It doesn't mean that they're all identical in terms of their severity or their level of impact in people's lives, but they are similar in terms of symptomatology, and it's a spectrum once again.
Yeah. Another question here is, what is the meaning of intruder dreams?
I've never heard that phrase, intruder dreams. I don't know if the questioner wants to clarify that.
Henry, would you like to clarify that question?
Sure. About a year after the loss of my wife, I began to have nightmares and then active daymares, sort of hallucinating violent things in my daytime. And they repeated at night. I would wake up swinging and fighting my way out repeatedly. And I then underwent treatment for PTSD, and it was successful, but it was quite scary. These were not the kinds of dreams or imaginations anybody would enjoy having. So I didn't know if that was a classic symptom or not.
Well, thank you, Henry, for telling us about that. Interestingly, when studies have been done to survey people's dreams after serious traumatic loss, it falls into a couple of discrete categories that people tend to have very similar kinds of dreams, not exactly the same, but it clusters into categories. Some people do have these more nightmarish dreams, and one could say that some of that, what you're talking about during the day, is a bit reminiscent of flashbacks of some sort, where it's sort of intruding into your day. So hallucinations, flashbacks seems to come into that sort of category. But, actually the majority of people after traumatic loss do not have nightmares. They have, first of all, dreams tend to become more vivid after emotional trauma. Although some people say they can't remember any dreams, but the majority report that they have more vivid dreaming. And the categories, there's a couple of categories. Well, one is a category where the lost loved one returns and oftentimes speaks and tells them in the dream that they're doing okay. Another category that is very common are traveling dreams. And in traveling dreams, it could involve, being on a bus, on a plane, on a ship, going on various sorts of voyages, and various events occur. And many people think that those are something having to do with coping with or struggling with the idea of changes and a passage of time and the need to travel from the past into the future, basically. So one of the interesting things is, again, I think it's evidence again of how our brains are hardwired we think of ourselves all as very unique and individuals. But the fact is that in the research I've done in this area, I've become more and more impressed by how our brains are hardwired to make us more similar than we think. And that even in the situation of dreams, that these dreams are archetypes because of the way our brains are hardwired.
It's interesting, this talk. It's so interesting. Thank you.
You're welcome.
Lisa, there's another question here. What may be one of the most creative activities you've heard of a patient using to process through their grief?
You know, I think that the possibilities are limitless in this regard. And it's a matter of thinking about in an individual fashion, what would be the right mode for each of us. Because, you know, many creative practices are a real therapeutic channel for people. And so, you know, some people are creative in wondrous ways. You know, they might be a photographer or dancer, they might be a musician. And all of those things are excellent opportunities, a painter, in order to, similar to journaling, but in a new creative way, to get back in touch with thoughts and emotions by finding your safe zone. Some people find that being out in nature is really the right move for them. And that when, and it's just, many of us can, I think, identify with that when you get outside and you're in a natural environment, it just tends to relax the mind. And so that can be the key for somebody. So you know, of course, some people find tremendous comfort from faith-based practices. And that is extremely important, you know, for some individuals. Again, not all. So I think that you can see, you know, to what degree there is incredible variety in the opportunities out there. And I'm very careful in my book to not say that this is the way to do it, but to say that we have to all get in touch with what is going to be the most productive approach for each one of us.
So the question here, this person has a post-concussion syndrome or a traumatic brain injury and asking if it's possible to rewire or retrain the brain because this person has aphasia.
Okay, well, you know, when we talk about neuroplasticity, it just isn't as mysterious as it may sound. You know, it might sound like a fancy scientific word, but right now, all of us are undergoing neuroplasticity because it's simply, as I said, rewiring of the brain in response to experience. So when somebody has speech difficulty and they go to a speech therapist, the speech therapist is attempting to also accomplish neuroplasticity by moving the brain circuitry in a direction and creating new connections to expand the abilities, the capacities in terms of speech and communication. So I see I really love this question because I've actually written about this topic. I see a very strong overlap between the topic of emotional trauma and physical trauma. Because if you think about it, when somebody has a concussion, or a more substantial traumatic brain injury, in all of those cases, there's also a very important element of emotional trauma. So at the end of the day, the neurologists and other clinicians who are caring for people with physical trauma, especially, you know, traumatic brain injury, how do you actually unravel the sleep problems or behavioral problems or memory problems caused by emotional trauma to those caused by physical trauma? So there's a strong overlap between these things. And neuroplasticity, again, it may sound, like something novel, but it's what we all relied upon when we learned, to ride a bike or anything we ever did. We relied on those properties.
And remembering what Dr. Shulman said today.
Hopefully.
This is a question from Greg. As a funeral director, what is a key piece of advice he should share with the families he serves?
That's a good question. I think that, it raises the topic of when people are ready and receptive to this versus when they are in a serious, it's such a serious moment of loss that it's more an aspect of shock. And so I think that one would have to gauge a period of readiness, what readiness somebody might have for this kind of information. I, for one, am frankly somewhat cautious about suggesting, for example, suggesting my book Before and After Loss and speaking to somebody who's had a very, very recent loss, because I think to myself, I don't really think that they're going to get much out of this right now, whereas maybe in a month or two, or maybe 6 months, it depends on the person, they will find themselves ready for it. I think the most important thing, now that I think about it, is that people who are undergoing very serious loss find themselves very impaired and unable to connect with all the great resources out there for people who are in trouble. Oftentimes people at a moment like that are isolated, and they, whereas maybe in their normal life, they would have been perfectly capable of doing a search and figuring out what are the best resources in their community or nationally. At that moment in time, they're robbed of those faculties because they're very impaired and very weakened by the loss. So I guess that the answer would be to ensure that one is providing a lot of opportunities to present resources to people who have had recent losses and to continually to come back to them with it, because they may not be able to remember much of it, what you're saying in those early weeks.
Yeah. I believe you've kind of addressed this, Lisa, but this person, Alicia, is asking, can a person heal from PTSD or is it permanent damage?
Well, PTSD has been, I'm just going to say that most of the work on PTSD, of course, was done by the Department of Veterans Affairs over the years. And PTSD has been very difficult to treat. And, it's that is why, there is some excitement going on right now about what I told you about MDMA. But I think that it's just not, I don't really want to leave you with the idea that one heals and that any of these serious problems go away. I think that it's more productive to think about how they are something that we are working on and to incorporate into our life story and to learn from really for the rest of our lives. So, even amongst the worst stories, they aren't things that we can ever fully close the chapter on. I don't know if that may not be what you want to hear, but I think that is, I try to be genuine.
Yeah. Is there a relationship between PTSD and OCD or obsessive compulsive disorder?
Well, I'm sure that, previous psychiatric history is going to have some impact in terms of, additional emotional trauma, emotional problems. So there's no question about that, but there is no formal relationship between the two. It is not as if it's not as if PTSD is more likely to result in a person who has obsessive compulsive disorder, but I'm sure that there is interaction.
And there are more and more questions, Lisa, but maybe we'll end on this because there is a lot of talk, as you well know, in the academic community and the medical literature now on resilience. And this question asks, what makes someone more susceptible to PTSD than another person, perhaps with the same sort of trauma, let's say?
I think I've also given a lot of thought to that because we can all think of examples where we know people who have undergone similar types of experiences of loss, and whereas one has sort of handled it relatively easily, another, was thrown for a loop, maybe even permanently. In terms of, I've studied this and looked at the literature. In terms of trying to understand why this difference occurs, I think we need to ask ourselves, to what degree does the emotionally traumatic event disrupt our self-identity? When the emotional trauma, when the loss is something that is very integral to our identity, to the story that we tell ourselves, about our place in the world, that is likely to be the cause of a very substantial impact that's going to be much more difficult to manage. When the loss is something that doesn't strike quite as centrally to one's self-identity, it isn't quite as impactful.
Yeah. Well, there are other questions which I know I'd love to get to all of them, but the hour is late. But there is a question I think that was asked by at least a half a dozen people, Lisa, and that is it possible to get a copy of your slides? So I've been pleaded with to ask you that question.
Well, I can send a hard copy to the American Brain Foundation. I'll send a hard copy to Jane Ransom.
Great, thank you, Lisa. Listen, I want to thank you for making yourself available tonight. I know it's late on the East Coast, but really appreciate your expertise. People have asked what the title of the book is, and Jane has let everybody know what the title of the book is, but maybe you just want to, one more time, Lisa, just tell everyone what the title of your book is.
The book is Before and After Loss, a neurologist's perspective on loss, grief, and our brain. And you can find the book on Amazon. It's published by Johns Hopkins University Press, and you can also find it at the Johns Hopkins University Press website, but the Amazon website is the easiest place to find it.
Thank you again, Lisa. Thank you everyone for tuning in this evening, and thank you for your time. And also again, thank you for your generous donations to the foundation, for those of you who have already given. And I want to preemptively thank those of you here tonight who haven't given yet, who will undoubtedly give in the future. So thanks everyone for tuning in, and thank you again, Lisa. Have a great night.
You're very welcome. Great to see everybody.
Bye-bye.
Bye.